All right, we're going to begin with Senator Eslinger on SB494. Thank you. Senator Eslinger, just good morning.
Good morning, Madam Chair.
Good morning.
Okay.
Begin when you're ready.
All right. Okay, so thank you so much for this opportunity to hear Senate Bill 494. It modifies provisions relating to healthcare advisory committees. So basically, well, for the record, Senator Carla Eslinger, District 33. This bill specifically looks at the Missouri Genetic Advisory Committee, the Missouri Brain Injury Advisory Council, and the Organ Donation Advisory Committee. And so under current statute, members of these boards must be appointed by the governor with the advice and consent of the Senate. This bill would change that to where they are appointed by the director of the Department of Health and Senior Services. The purpose is to help these committees and councils that are strictly advisory. They don't have a funding source. They don't have any kind of true governance. They're just advisory, to operate more efficiently, allowing the director of the Department of Health and the Senior Services appoint these positions directly to do just that, to advise. So basically that's it. It's just to remove those three committees that are truly just advisory, no revenue piece to it, no governance piece to it. It's just to advise that department for them to be appointed by the director of the Department of Health and Senior Services. So with that, Chairman, and now do you want me to repeat all that? So anyway, with that, I'll take any questions that you have.
All right, are there any questions for the senator? Senator Moon?
Good morning, Senator.
Good morning.
Are there current vacancies in these three committees?
You know, I do believe that there are, but let me look around the room to see. Yes, see? Nodding, yes.
And
Part of the problem is that because, you know, it takes a long time for that process to where it goes through the governor's office and then they make recommendation to the gubernatorial appointment committee and then it goes before the Senate. So these three are, like I said, just truly advisory. And so this would just speed up the process to where the director had an opportunity to have a full board of members on each one of those advisory committees so they could do the job in which they were prepared to do.
so it's more an effort to expedite the process on filling the vacancies.
Yes, sir.
I don't recall the history behind why the governor was required to appoint these folks. Do you have
You
any
know,
idea?
that was the question I asked as well. And I was told that they were just wrapped into the statute back when the statute was first put in about the process of. There's not and actually we have probably when he testifies, he'll be able to give you a more clear answer, but we just know it's been this way for a very, very long time and it has not worked very well. And they really do want these advisory groups to do what they want them to do, and that is to be the voice in the field and the voice for the practitioners to advise the department.
And I know you mentioned vacancies. Are there some whose members whose terms have expired and they're being retained, or are they just gone altogether?
I know that there has been
Head
some
shaking.
people whose have expired and they haven't been filled. Some who are still running on expired terms. They want to be able to move them along. Not that they're doing a bad job, but that's part of it, right? Is to recycle and get some new thoughts and new ideas on that board. So.
Okay, thank you.
Uh-huh.
Any other questions for the senator? Seeing none, thank you.
Okay.
Is there anybody here to testify in favor of? And while you're coming up, we're going to go ahead and take a roll call real quick.
Senators Coleman, Carter,
Here.
Arthur, Gannon, Moon, Thompson Rader, Washington.
Thank you. All right, seeing that we have a quorum, we're going to go ahead and continue with testimony in favor of the bill. Thank you.
Hi, my name is Ben Terrell. I am the Legislative Director for the Department of Health and Senior Services. I want to thank Senator Eslinger for her time in carrying this bill, and I want to thank you all for your time in hearing it today. This is a department proposal that will help make us more efficient and effective in what we do. These committees are purely advisory. They don't control funding. They don't control any programs or anything like that. And so in their role as advisory, they are very helpful because as laid out in statutes, we have, doctors, pediatricians, folks who are family members or have had a brain injury, who have gone through the organ donation process. And so they're very helpful in this role, but because of the process, we have some trouble filling those vacancies. And so we do have quite a few on these committees. We do not touch the qualifications of who has to be on here. Those are still set out in statute so that it's folks who understand the topics that they're talking about and working on. This will just help us be more efficient and effective.
Do you know how many advisory boards you have? How many people are on those boards?
I would have to get back to you on the all of them within the department, but I know that the Genetic Advisory Council has 15. The Brain Injury Advisory Council has 15, and then I would have to get back to you on the Organ Donation Advisory
Yeah,
Committee.
if you would, I'd appreciate that.
Absolutely.
Any other questions for the witness? Seeing none, thank you.
Thank you.
Anyone else here to testify in favor of the bill? Seeing none. Any here to testify against the bill? Seeing none. Any here to testify for informational purposes only? Seeing none. Okay, we'll move on to. Okay. Senator Eslinger, do you want to go ahead and just? We'll hear SB553. Yes. Just stay there, will you? All right, begin when you're ready.
Good morning again. For the record, Senator Eslinger, representing the 33rd Senatorial District. And before presenting Senate Bill 553, so before going into the ins and outs of what exactly this bill does, I think it's about Parkinson's disease. I think it's important for the community to know what Parkinson's disease does to the body and the effect of it has not just on that individual, but their family members. Parkinson's disease is a chronic neurodegenerative disease or chronic motor system disorder that gradually worsens over time. Now, in the beginnings, this can manifest as problems with memory, ability to accomplish tasks, and over time, as the disease progresses, some people may develop dementia, tremors in their extremities, and difficulty for day-to-day tasks. There's no treatment to slow, stop, or reverse the progression, nor is there a cure. Average onset for PD or Parkinson's disease is over the 50. However, many with young onset Parkinson's disease occur in those ages of 25 to 45. More than 1 million Americans, including 110 of our military veterans, live with PD, and it costs around or over $52 billion each year in medical and non-medical expenses. So the point there is the time is to act now if we hope to be a part of the change to help support those with PD. This legislation would create a statewide population-based registry that will be used to measure the incidence, the prevalence of PD upon diagnosis. Surprisingly, little is known about how PD is distributed among different population groups, whether the patterns of the disease are changing over time, and learning who has PD is one of the best chances there is for researchers to understand more about the disease and discover how to slow and stop its progression. In quick summary of this bill, it will ensure 5 things. 1, establish the infrastructure for the collection of reported patient population data. It'll create a clinical advisory committee. It will require mandatory reporting of patient population data, incorporate strong confidentiality provisions, and require an annual report for the legislature and fact sheet published online. So again, Madam, thank you for providing me this opportunity to present my bill. And with that, Madam Chair, I welcome any questions. Thank you.
Thank you. Are there any questions for the senator? Seeing none, is there anyone here to testify in favor of the bill?
Good morning.
Good morning.
Madam Chair, members of the committee, my name is Lynn Schlosser, and I'm a registered lobbyist for the Michael J. Fox Foundation on Parkinson's Research. The Michael J. Fox Foundation was founded in 2000 and has been singularly dedicated to finding a cure for Parkinson's disease through an aggressively funded research agenda and to ensure the development of improved therapies for those living with PD today. To date, the foundation has raised more than $1.5 billion and spent on research funding. The Missouri Parkinson's Research Registry could truly power significant progress toward the treatment and ultimately a cure for Parkinson's disease. Patient registries can provide a real-world view of clinical practice, patient outcomes, safety, and compliance effectiveness. Registry data can also inform policymakers on healthcare equity disparities and influence of social determinations. Parkinson's disease is currently the fastest growing neurological disease in the world, and the number of people with PD is expected to double by 2040. As the senator did mention, the best chance that researchers have to further research this disease is to actually know who has it. Currently, no data is being collected who has the disease, so it's very hard to determine why. Wanted to let you know we are partnering with the University of Missouri as the data collector on this program. They had a conflict of interest this morning, couldn't be here, and wanted me to let you know they fully support this legislation. I'm happy to answer any questions.
Thank you. Are there any questions for the witness? Seeing none, thank you. Anyone else here to testify in favor of?
Madam Chair, members of the committee, my name is Mo McCullough. I am a past registered lobbyist. I was here for 23 years lobbying these halls, and I have Parkinson's. My journey with Parkinson's, and I will be brief, I'll try not to repeat anything, I just want to go over a couple of things. My journey with Parkinson's started back in 2011. It took 4 years before I was finally diagnosed, and then 4 more years before I retired. I retired 2020, and it took me 4 years to get diagnosed. One of the things, and I might want to say this, and thank you for mentioning all the a lot of the non-motor symptoms. Parkinson's is not just motor symptoms. It's not just the shaking. 30% of the people who have Parkinson's don't have tremors at all. So when someone says I have Parkinson's, and that you look at them and say, well, you look great, you're not having a problem. Everyone with Parkinson's has a different set of symptoms. There are so many. There are over 20 non-motor symptoms that are identified with Parkinson's now, and they're growing. If I stumble and stammer, my main issue is cognitive, pretty much, and that's the reason that I had to retire. I could not get up here like I am and carry on a thought, or I'll forget words or miss words or use the wrong word. So I just wanted to make sure that the importance of the non-motor symptoms are, far greater in many instances than the motor, because the motor symptoms can be handled quite well with the carbidopa-levodopa, with the main drug, with the main Parkinson's drug. But this piece of legislation is important to millions of individuals in the United States and the world who have Parkinson's and are suffering from this disease. One of the things that I learned going through this process was that there's so much more that needs to be done and needs to be learned, and this kind of legislation is what's necessary to further the advancements that have already been made. Such things as pinpointing causes, prevention, timely and accurate diagnosis, symptom management, improving quality of life, finding a cure. And with this kind of research, I don't think anybody mentioned it yet today, but veterans, there's a high percentage of veterans with Parkinson's. And this research will help determine where, why, is it clustered somewhere? And you hear all this about the pesticides. This kind of information will let the researchers know, okay, in this area, this particular pesticide, there seems to be a greater number of Parkinson's. And those kind of things are what are important, and I think that this legislation will help that. It's a nationwide push. There are, I think, 5 or 6 other states that already have some form of registry with Parkinson's. There are several through the Michael J. Fox that they're working on. Missouri is a target state. So I just want to thank you for hearing this important bill. I appreciate your time, and I hope that you'll help move it forward for us.
Thank you for your testimony. Is there anyone here with questions for the witness? Seeing none, thank you, sir. Is there anyone else here to testify in favor of the bill? Anyone here to testify against? Anyone here to testify for informational purposes? Okay, seeing none, thank you, Senator. All right, we're going to begin with SB 418, Senator Brown. Please proceed when ready.
Good morning, Madam Chair, members of the committee. For the record, Senator Justin Brown, representing the 16th Senatorial District. I'm here to present Senate Bill 418. Senate Bill 418 attempts to allow for Missouri to have the same telehealth flexibilities that other states in the U.S. have. It allows for digital and computer-based questionnaires to be utilized for simple, low-acuity cases. During the public health emergency, Governor Parkinson signed an executive order allowing flexibility in telehealth services. This allowed providers to see patients through platforms like Hypnosis. During the pandemic, hundreds of thousands of patients were seen through this platform, I think in the tune like 150,000 just in the state of Missouri alone, without a single complaint or disciplinary action being sought. Currently in Missouri statute, telehealth is limited to phone or video conversation. Senate Bill 418 would allow for a visit to be started via questionnaire and then sent to a provider for review. Nothing in this language takes away from the requirement that a physician assistant, or nurse practitioner review and make the diagnosis. The questionnaire simply starts a process of information gathering for the provider. The language requires that the information be sufficient to provide information as through a medical interview being performed in person. In other words, only low acuity periodic health care would be eligible under this language. Thank you for the hearing today, and I am willing to take any questions.
Are there any questions for the senator? Go ahead, Senator Moon.
Good morning, Senator. About 35 years ago, I was involved in an institution that did, it was kind of like pre-telemedicine. It was called telemetry, and it was mainly looking at heart patterns. Since that time, though, we've advanced quite a bit, and I just wonder, in your bill, is it primarily limited to the questionnaires and the receipt of that information, or does it go beyond that to provide the ability to diagnose?
It's limited to just a questionnaire.
Okay.
Yeah.
Okay. Very
And
good.
then they can determine at that point whether, the physician or the PA or the nurse practitioner still has the ability to say, okay, fill out the questionnaire, we'll treat you, or, they may want to see you in person.
Very good. Thank you.
Mm-hmm.
Any other questions for the senator? Seeing none, thank you, Senator. Are there any witnesses here to testify in favor of the bill?
Thank you, Madam Chair. Members of the committee, Justin Alferman, registered lobbyist for SSM Health. We would like to go on record in support of Senate Bill 418. I'd be happy to answer any questions about the logistics and how this process works. We did have, as the senator pointed out, we did have this technology under Executive Order 2004 from roughly the beginning of the pandemic to through last year. We saw 150,000 patients during that time through this technology, and not a single complaint to the Board of Healing Arts or against any physician who was seeing patients under this. How this works is you log on to the website, and what the adaptive questionnaire does is it predicates subsequent questions based upon the questions that you've already answered. Think of the adaptive questionnaire as the routine whenever you go to your doctor's office right now and a nurse or a nurse practitioner sees you and asks you those first initial questions and builds your chart. That's what it is. And then that information gets sent to a provider in the state to review. If there is not adequate information, there's also provided during that adaptive questionnaire, they can ramp it up to a traditional telehealth visit, either via a phone call or a video visit as well. In fact, I tell the story, and I've told the story previously in testimony. On Easter morning 3 years ago, my son developed pink eye. And as you know, on Easter morning, there are no physician's offices open where he could be seen. And so we used this technology for my son. We went through the adaptive questionnaire. We did all of the information. We sent it off, and it came back within 15 minutes. And the physician said, I can't make a diagnosis based upon the information that you've sent. I need more information. I need you to snap a photo of the eye and send it back in. We did that. So there are checks and balances based on in the language where it provides, is the information sufficient to provide a thorough medical interview? In that instance, it was not, and we had to have subsequent pictures and questions asked by the physician. So I do want to point out that nothing in this language allows for artificial intelligence or a computer to render health care. 100% of these charts are still reviewed by a physician, physician's assistant, or a nurse practitioner, as prescribed in statute. Be happy to answer any questions.
Are there any questions for the witness?
Madam Chair, I have a question. Hey, thanks so much for your patience. I'm sorry I got here late. You and I had a conversation about this bill in my office about when the patient-doctor relationship is established, and you were going to find out a little bit more from your lawyers about that. Can you follow up on that issue?
Yes, I forwarded that information to your office.
Well, this is awkward. Great. Then
No.
I'll review that.
But no worries. No,
No,
worries,
we have a packed house. You sent it to me. I'll review it, and we'll let the chair continue with this bill.
I can easily.
No,
okay.
we've got a long list, so if you've
no
sent it to me
worries.
already, awesome. Thanks.
Any other questions? See none? Thank you.
Thank you.
Is there anyone here? Now I'm totally thinking about this email.
I'll send it to the committee.
Thank you.
I would be. I forgot. Sorry, in my haste. I would be happy to walk any senator through this. That we have this technology available in other states that we operate in, Oklahoma, Illinois, and Wisconsin. So I can walk you through just how this process works in case you have questions of how this is actually administered in other states. I can actually walk you through that at a later date.
That'd be great.
Yep.
See my chief of staff, will you?
Yeah, absolutely.
Oh, great. Okay, is there anyone else here to testify in favor of the bill?
Members of the committee, Megan Travis Henderson on behalf of Missouri Hospital Association, here to support Senate Bill 418 for all of the reasons Justin stated, and essentially it increases patient access to care, and we are in support of that. Happy to take any questions.
Any questions for the witness? See none, thank you. Anyone else here to testify in favor of the bill? Seeing none, any here to testify against?
Madam Chair, Shannon Cooper today representing America's Health Insurance Plans and Blue Cross and Blue Shield of Kansas City. Just slightly oppose the legislation. We don't want to be in a position where...
I don't know if that's a
Can you hear me any better?
official position. Slightly opposed?
Slightly opposed.
Slightly
We
opposed.
just want to make sure that computers are not treating and prescribing medication to patients. We want to make sure that that doctor-patient relationship is involved in this. We don't want the adaptive questionnaire making that decision on, if I call in, I fill out that questionnaire, there is no human contact with it. And I've spent years with Justin working through this, and hopefully we can come to a solution where we're comfortable to make sure that there is a medical professional at some point involved there. As technology changes, we have great concern that there might be individuals who would use artificial intelligence to start prescribing and treating patients, and we don't think that's safe and creates good outcomes for our members. With that, I'd be happy to answer any questions.
Any questions for the witness?
They want to continue to make sure insurance companies are treating patients and not doctors.
We'll add that to the witness.
We like oversight.
All right, seeing none.
Thank you.
More regulation noted.
Yeah.
Madam Chairwoman, members of the committee, Gannon on behalf of the Missouri State Medical Association. We did have the opportunity, our group, to go through the process with Justin, and we are working with stakeholders, working with him to come up with some language to address all our concerns. So we are working through the process, though.
So it's safe to say that you are opposed to the.
Yes, we're
Okay, thank you. All right, any questions for the witness? Seeing none, thank you. Any others here to testify against? Seeing none, any here to testify for informational purposes only? All right, seeing none. Any other comments?
Thank you, Madam Chair, members of the committee, for the opportunity to present this bill.
All right, thank you. All right, we're going to go ahead and turn the committee over to the chair, and we'll continue with SB507.
Actually, we're going to make a quick change of order and go to House Bill 1010. I apologize. Since Senator Gannon, you have to stay here anyways, I figure we'll let these other guys in and out. Thank you so much.
Thank you, Madam Chair, members of the committee. Phil Christofanelli from the 104th District here to present House Bill 1010. It's a very simple and short bill. It's received, almost unanimous support throughout the process, and it is designed to protect the personal information of children. And as I'm sure the committee is aware, there are a number of federal statutes that protect information in these circumstances. There's FERPA, which deals with protecting education privacy, and there is HIPAA, which deals with protecting healthcare privacy. However, as I'm sure you know, the Department of Elementary and Secondary Education often provides certain healthcare-like services to parents and families, and they fall into a difficult gray area in the law in that they are not a covered entity under HIPAA, so they're not subject to those privacy requirements, and they're not providing education services in these instances, so they're not covered by FERPA. And so we want to clarify in the law that when departments like the Department of Education engages in these type of activities, that the personally identifiable information of the children in their care is not disclosed to the public unnecessarily. And so with that, Madam Chair, I'm happy to entertain any questions.
Are there any questions of this bill's sponsor? Seeing none, with those in support, please come forward.
Or I can just lose a little weight, and I think it'll all work out better. Madam Chair, David Winton here on behalf of the Children's Trust Fund. Fair enough. We just want to go on record in support of the legislation. Representative Christofanelli explained it great, and we appreciate the time of the committee as well as the sponsor.
I'm sorry, which group are you testifying for?
Children's Trust Fund.
Thank you. Any questions for this witness? Thank you for your testimony. Anyone
Thank
else
you.
in support? Is there anybody else in support? Seeing none, anyone here in opposition? Seeing none, anyone here for informational purposes only? Seeing none, this concludes the hearing on House Bill 1010. Thank you, Representative. Okay, so we're going to go now to Senator Gannon, 507. Sorry. He had to go. Thank you, Senator, whenever you're ready.
Good morning, Madam Chair, members of the committee. I represent District 3. Thank you for the opportunity to present Senate Bill 507, which deals with lead testing in children. Senate Bill 507 cleans up the standards for when kids should be tested for lead poisoning. The current standards are all over the place and make it hard to be in compliance, leading to less kids being tested for lead. This is a proposal from the State Department of Health and Senior Services in an effort to provide the option of lead testing to more children. The department is here to take questions as well. Thank you again for this opportunity.
Thank you. Are there any questions for the senior senator from Jefferson? Yes, please proceed.
Morning, Senator.
Morning.
So as I understand this bill, it's primarily taking away the responsibility from the state and applying it directly on the shoulders of the parents, where it probably should be anyway. Is that correct?
I think so, and some of the witnesses can probably add to that.
All right, thank you.
Any further questions for the senator? Seeing none, would those in support, please come forward.
Hello again. My name is Ben Terrell. I'm the Legislative Director for the State Department of Health and Senior Services. I want to thank Senator Gannon for carrying this bill, and I want to thank the committee so much for hearing it. As we all know, lead is detrimental to the development of children. In particular, the more a brain develops, the more the interference from lead can interfere with that development, and so it's a very serious impact to these kids. The current standard for which children need to be tested for lead is, like the senator said, a little all over the place. It deals with geography, questionnaires, age, and it's only once in the course of 6 years as opposed to annually. And so essentially what this proposal would do is it would say that every kid 3 and under shall be given the option of a test annually, and then every kid 3 and under shall be screened with a questionnaire. I'm sorry, every kid 6 or under 6 shall be given a questionnaire to determine if they are high risk for lead poisoning, and if they are determined high risk, given the option for a test. This is all optional. A parent can opt out. This would be the pediatrician would be the one offering this test, and then the parent would have the option to take them up on it or not. I do want to say there is a slight problem with the language. The very first 2 sections delete some language that was meant to clean up what we thought was unnecessary language. And we inadvertently made it so that we can't work with local public health agencies and hospitals. So we're going to try to get that fixed moving forward at your allowance, and work to make sure kids are getting tested for lead poisoning.
Great, thank you. Any questions for Ben? Seeing none, thank you.
Good morning, Madam Chair, members of the committee. Garrett Webb, registered lobbyist for the Missouri chapter of the American Academy of Pediatrics. I want to thank the senator for bringing this forward. We've worked on lead remediation language for several years. One thing that I wanted to note is, we think of perhaps areas that the senator represents as being the highest areas of concentration for lead, but a lot of areas inside of some of our highest income portions of the state, including places like Ladue and University City, Compton Heights, Lafayette Square, all of those where prevalence of old houses exist, where perhaps pipes contain lead, and that wouldn't be necessarily something that a physician would know right offhand looking at a patient and saying, you're from Ladue, you're fine, where they might actually have a potential to receive exposure to lead to a high concentration of lead. So we think this streamlines it. We appreciate the department and the senator on working with this to make this healthy change for kids.
Thank you so much. Are there any questions for this witness? Seeing none, those in favor?
Good morning. Katie Gamble here on behalf of the Missouri Center for Public Health Excellence. We want to go on record in support of the legislation, specifically after the changes that are hopefully going to be made in committee that Ben referenced earlier, to make sure that what's already an existing statute that allows the department to work with locals on lead issues remains intact.
Great, thanks so much. Any questions for the witness? Seeing none. Anyone else in support? Anyone here in opposition? Anybody here for informational purposes only? Seeing none, Senator, do you have any closing remarks?
Thank you for allowing me to present Senate Bill 507.
Thank you, Senator. We're going to move on to Representative Kelly's 283.
Good morning, Madam Chairman and members of the committee. For the record, my name is Hannah Kelly. I represent District 141. Today, I bring before you House Bill 283 in regards to patient exams. Senator Arthur has carried the companion bill here in the Senate. The intent of this bill is to protect patients' rights when they are under anesthesia or in a state of unconsciousness. The bill would allow healthcare providers, trainees, and medical students to perform patient examinations after obtaining specific informed consent from the patient or a person authorized to make medical decisions for the patient. The bill also permits patient examinations if they are necessary for diagnostic or treatment purposes or for the collection of evidence for a suspected sexual assault. If a patient examination is conducted, the healthcare provider must notify the patient. I would like for the committee to add language that would match Senator Arthur's bill and would eliminate any burdensome notifications for medical providers for exams that are part of care, but also not create any loopholes. This language should help patients to still be notified of a medically necessary exam when they are unable to give written or verbal consent, and there are circumstances which imply consent. With that, I am happy to take any questions, and thank you for your time.
Are there any questions for Representative Kelly? Seeing none, those in support, please come forward.
Good morning, Madam Chair and committee members. My name is Julie Donnellan, and I'm the president and CEO of the Metropolitan Organization to Counter Sexual Assault. I've worked in the field of sexual violence for over 30 years, and on behalf of MOX, I'm testifying today in support of House Bill 283. MOX is the Rape Crisis Center serving the greater Kansas City metro area, including Jackson, Clay, Platte, and Cass counties in Missouri. Our mission is to improve the lives of those impacted by sexual abuse and assault and to prevent sexual violence in our community. House Bill 283 will provide patients in healthcare settings with the critical assurance that medically unnecessary pelvic, anal, and prostate exams will not occur without their consent. While this practice may be rare, even one exam of this type taking place is one too many and can have broad implications for survivors of sexual violence. We know that victims of both sexual assault and abuse face many barriers when accessing health care in the short and long-term aftermath of violence. The result of this range from increased rates of unintended pregnancy and sexually transmitted infections to PTSD and stress-related mental and physical health outcomes. We regularly work with survivors who are apprehensive to access care due to fear of being re-traumatized. As advocates, one of our primary responsibilities is to reduce barriers that survivors face on their path to healing and recovery. Survivors already experience significant fear and stress after the trauma, and the last thing that they need to worry about is that the healthcare provider may conduct a genital exam without their knowledge or their consent. When people receive a medical procedure under anesthesia, we are literally placing our lives in their hands and our trust with that medical team. To learn afterwards that an unnecessary, unrelated pelvic or genital exam was conducted without our consent is a serious violation of that trust, and the impact is even more severe on survivors. House Bill 283 removes one of those roadblocks that survivors may face as they work to rebuild their lives and regain their autonomy. If a survivor hears about this practice occurring, this bill will allow advocates to definitively state that this will not happen in Missouri. I ask for your support of House Bill 283, and I stand for questions.
Thank you, Ms. Donnellan. Any questions for this witness? Thank you for being here. Anyone else in support?
Good morning, Madam Chairwoman, members of the committee. Tricia Workman here today representing the Missouri Coalition Against Domestic and Sexual Violence. I know you all have heard the Senate version of this bill and debated on the floor. We do want to thank the medical community for working with us on this to tighten the definitions and ensure that we're doing what we need to do to protect patients, and thank the sponsor. Any questions happy to answer any questions if you have any.
Seeing none, thanks for your testimony. Anyone else here in support? Anybody else? Seeing none, anyone here in opposition? Anyone here for informational purposes only? Anyone else have a piece of paper Tricia needs to pass in for you? Okay, thank you, Representative, for your
Thank you,
here.
Senator.
That concludes the hearing on House Bill 283. We're going to move to House Bill 154. Representative Thomas. Let's go last. Go ahead whenever you're ready.
Thank you. Let me get my papers out. Good morning, Madam Chairman, and also members of the committee. I'm Lisa Thomas. I am representative from District 123, Lake of the Ozarks, and I'm very happy to be here to present House Committee substitute for House Bill 154. As I'm sure you hear lots of times, this is a pretty simple bill. It's relatively clean up language, if you will, taking some things that were out of date and improving the statute and helping people with terminal brain cancer and folks that have other durable medical equipment that can therefore be eligible for a sales tax exemption. So I'm going to read you just the summary. This is the best example here of what's covered. Current law provides a sales tax exemption for certain durable medical equipment as defined on January 1, 1980. And again, highlight 1980. And that's by the federal Medicare program. But this bill removes the reference to January 1, 1980. Clearly, a lot of medical advances have happened since 1980. And so this bill provides a sales tax exemption for sales of Class 3 medical devices that use electric fields for the purpose of treatment of cancer, including components and repair parts, and disposable or single patient use supplies required for the use of those devices. And in addition, current law provides a sales tax exemption for the sales or rental of manual and powered wheelchairs, including parts that would go along with that. Interestingly, though, if you didn't purchase those supplies at the time of the purchase or rental and got those later, they were not subject to that sales tax exemption. This bill eliminates the time frame, so the purchase of those accessories, for example, a seat belt, for example, would be covered, whether that was at the time of initial purchase or down the road. Again, something I think Johnny on the street corner would understand, kind of makes sense. So that is a quick summary of the bill, and I'd be happy to take any questions.
Are there any questions for Dr. Thomas? Seeing none, anyone here in support of the bill?
Madam Chair, pardon me, members of the committee, Ray McCarty, President of Associated Industries of Missouri. You've already passed out a bill very similar to this, Senator Koenig's 173. Pardon me, so I don't want to dwell on the point knowing that you have a long list of bills. I do want to say a couple of things. One, we passed language that we thought did the trick in 2016. Governor Jay Nixon signed that bill into law, but then the Department of Revenue decided that they had to read that 1980 date as meaning that even though we passed the bill in 2016, it didn't apply to what we wanted, this durable medical equipment, because of that 1980 date. So this bill takes that 1980 date out. You'll recall when I testified before on Senator Koenig's bill that we also mentioned there would be a belt and suspenders approach. So we want to make darn sure if we pass this bill this time that it's able to be signed and that it does have belt and suspenders. So we specifically describe the items that we're talking about that help extend the life of brain cancer patients, and that's exactly what we're after. So this has both. I'm happy to answer any questions.
Thank you, Mr. McCarty. Any questions? Anyone else here in
Thank you.
support? Anyone here in opposition? Anyone here for informational purposes only? Thank you, Representative.
Thank you very much for hearing the bill.
Representative Cope, that concludes our hearing on House Bill 154. We'll now move into hearing House Bill 677. Representative Copeland, proceed when ready.
Thank you, Madam Chair. Thank you, senators and the committee members. Representative Copeland, I represent District 120, Crawford and Dent County. Bring you House Bill 677. Basically, if you look at the bill, there's one sentence that was being added, and that is due to an incident that happened this summer with the Child Advocacy Division. It's very specific. With an incident occurred where the tip line was, they were on a phone with a tip line and a crime had been committed where a kidnapping had been taking place. And the Child Advocacy Division had their hands tied by releasing that information to law enforcement. So it took them several hours to get this information to the police. Luckily, it ended up where they did find the person that had the kidnapping. But the reason I'm bringing this to you, and it's very specific, the disclosure is at the request of law enforcement is what we're adding. So as a law enforcement officer for 28 years, when a crime is being committed, you go through steps. And I would have contacted, parents, anybody involved, child, and this kid actually happened to be in the custody of the state, so it even limits it even more. So as a law enforcement officer, I would have went to the state, asked them what was going on. Child Advocacy Division had a review, I would go through them steps and ask each individual agency and people involved if they had any information on this crime or incidents being occurred. So that's all I'm asking for on this paperwork, is to be able to allow the law enforcement to request the information to Child Advocacy Division. The incident prior to, it would have been a crime for them to release that information. So they had to go get a warrant, go through the court system, and it took them 4 to 6 hours to get that information. So this would just be speed the process up, and it would be very limited on what would be released and when it could be released. And I think when our children are involved, time-sensitive matters make a difference. And this, like I said, is very limited on what information would be given and who would request it. Thank you.
Representative, what information would be released? Because right now, as I read the language, it says the entire file.
That you might be able to ask the person behind me. I know that as far as me going as law enforcement, do you have any information on this person? I don't think it would be the whole file. It would be the crime or the incident at hand. Because I think what the information they were wanting to release at the time was the name and the incident that was going on and the location if they had it.
Fair enough, but I think the plain reading of the language is incredibly broad. So
On the whole part here?
right, it just says any files maintained by the advocate program shall be the disclosure is at the request of law enforcement. So this means the entire file done by this investigative branch of government could be provided without a warrant and in full.
That makes sense. I agree with that. I think that's not the intent of that. I can definitely want to look into that to make it more restrictive.
Okay, let's work on that.
Because I agree with you. My intent was just to make sure I get the information in a timely manner of the current incident at hand. Not
I mean, the location of the child really is the piece that they were looking for, and
but
that feels to me to be pretty limited in scope.
I agree with that, but we don't want to limit it so much that they can't release the information to find that person if they need an additional. Do you release the household funds? But I agree with you. I want this is limited to get the incident at hand taken care of, not all the information they had from 6 years on that person. That's not the intent.
Okay, great. Any other questions for this witness? Seeing none, thank you for your for being here. Anyone in support? You get to stay. You can stay
Okay.
there. Yeah.
In the house, we get up and leave.
Yeah. We do things a little differently.
Good morning, Madam Chair, members of the committee. I am Becky Ruth. I'm the Executive Director for the Office of Child Advocate. I'm here to testify in support of House Bill 677. Concerning the questions you had earlier, right now our department is under strict confidentiality. We sign confidentiality agreements with the Department of Social Services, so we cannot just haphazardly release any information. We are very, very stringent on what information we can release. We cannot release any information on a child's file unless you are a legal party to the case. So what this is referring to is the identity of our complainants. So if you read on here, and I think really some of this where it talks about any files maintained by the advocate program shall be disclosed only at the discretion of the child advocate. I think that's when we come into things like sunshine requests and things like that. Even at that, we are bound by that confidentiality and privacy. We have signed agreements and we are not allowed to. And this whole section here is more about the identity of our complainants because our complainants remain anonymous unless the complainant gives us permission to reveal their identity. There's a box in our complainant form that they can check, or they can send us an email saying, I give you permission, or there's a court order to do so. In this case, we had the phone number. This person was a complainant. She had kidnapped the child. She was not supposed to have contact with this child and had kidnapped the child. Had placed the phone call to our office. We were very concerned about her mental health status at the time. She was extremely irrational. The child even got on the phone as well. Made a threat against the life of one of my staff members. Said he was going to come down and blow her head off if we didn't give them the help that they were wanting. We could tell something wasn't right. Children's Division and Juvenile Office are always notified when we open a case review. So we used our discretion to call Children's Division. They were aware we were doing a case review just to try to check on the status of the case since we were concerned, and we couldn't give any information that this woman had just called our office because she was our complainant and we could not reveal her identity. It's a Class A misdemeanor if we reveal the identity of a complainant. We found out through the course of that conversation that the child had indeed been kidnapped. Law enforcement was involved. Children's Division said if you have any information that you can give law enforcement to assist since you're doing a case review. We're going, we really can't. It was very frustrating for us because we had the contact information, the place she was calling from, and law enforcement could have used that information to find the child more quickly. In this case, the only way we could come up with a workaround that was because there was actual death threat to my staff member's life. We were able to file a police report regarding that. They were able to contact juvenile office, but this took hours and hours. And in situations like this, it's so time sensitive to try to find that child and look at the safety of the child. So. But we are very, very stringent in our confidentiality. We are not allowed to release information unless you are a legal party to the case, because it's a juvenile case. And so these are only children in state's custody that we're talking about. But I would be open to if you have something to improve the language.
Great. Anybody have any questions for this witness? Okay. Thank you, Representative. Anybody have any further testimony in support of House Bill 677? Anyone here in opposition to 677? Anyone here for informational purposes only? Okay, thank you, Representative. This concludes our hearing on House Bill 677. Representative Coleman, Coleman's go last in this hearing, so if you're ready to present House Bill 454, please come forward.
Good morning, Madam Chair, committee members. Good to be here and good to see all of you. Thank you for the opportunity to hear this bill. First of all, for the record, my name is Jeff Coleman. I'm representative for the District 32 out of Grain Valley. And I'm here to hear this bill and to promote this bill for human trafficking issues. Been involved with this issue for some time now, and it's something that as we look back at what we've been trying to do in helping to stop this issue, it's not working. So we're trying to take a different approach. We're trying to, instead of going after the victims and the traffickers, which are very, very hard because there's so many different levels or layers of them. We're going to go after the perpetrators, because if we can stop the demand, maybe we can put a dent in this problem. So what this bill does, it increases the age of the term minor and increases the charges against those who are enticing, soliciting, or patronizing prostitution when the victim, or if you want to call prostitute, is below the age of consent, which is 17 in the state of Missouri. The bill modifies the offense of enticement of a child by increasing the age of the victim from less than 15 years old to less than 17 years old when the perpetrator is 21 years old or older. Additionally, the bill modifies the penalty provisions for the offense of patronizing prostitution. Currently, the penalty distinctions are for older than 14 years of age and 14 or younger. This bill increases the age from 14 to 15 years old and modifies the offense of patronizing prostitution if the individual is 15 years of age or younger from a Class D felony to a Class B felony. It also changes the age from 14 years to under 18 years of age when allowing the admissibility of visual and oral recording of a verbal or nonverbal statement of a vulnerable child in lieu of testifying in front of a court. This bill mirrors the age guidelines in our federal laws regarding patronizing prostitution. The victims of these circumstances are our children and our young adults that have been groomed or enticed in these acts. This bill passed out of the House 149-2. So with that, Madam Chair, I will take any questions.
Any questions for this representative? Seeing none, anyone in support, please come forward.
Good morning, Madam Chair, members of the committee. My name is Locke Thompson. I'm the Cole County Prosecuting Attorney here on behalf of the Missouri Association of Prosecuting Attorneys, and we just wanted to go on the record in support of this bill. Not only does it help us as prosecutors to go after the people who are going after kids, but there are measures in here that also help to protect the mental health of children who have to go through the court process who have been victims of these types of offenses. So we think this is an excellent bill, and just I'm happy to answer any questions.
Any questions? Thank you for your testimony. Anyone else here in support? If anyone wants to stick around with me afterwards, we can do the weekly pushing back of the tables.
Thank you.
Good morning. My name is Amy Robbins. Thank you for your time for allowing me to be here today. I'm the Director of Forensic Services at the Child Advocacy Center of Northeast Missouri. I'm one of 15 CACs across the state of Missouri, and our center serves the suburbs of St. Louis all the way up to Iowa. We're here in support of House Bill 454, and this legislation would be huge for our kids. We serve about 1,200 kids and vulnerable persons annually just through my center alone. We know that child advocacy centers were designed to protect our most vulnerable victims, our kids. And we also know with that working within this multidisciplinary team model is proven best practices and something that we adhere to in the state of Missouri. But oftentimes our kids over the age of 14 don't get the support that those under 14 get without this legislation passing. How we use the statutes, particularly 491 and 492 that are spoken about in this bill, are huge. They help us reduce trauma to our kids and families. They help us use proven best practices. They also ensure that all kids, not just those under the age of 14, get the support. We know that they allows them to have access to child advocacy centers, and we also know that this population is of our most vulnerable victims. Kids between the ages of 12 to 17 are the most high risk for a sexual assault, and primarily this is where we see this statute come into play. I have a daughter who will turn 14 from 13 in just a couple weeks, and there's nothing that's magically going to happen to her that's going to make her more prepared to take the stand without a forensic interview being played behind her, or without the expert testimony of a forensic interviewer that our kids under the age of 14 get. We know that in this conjunction with allowing these DVDs to be played, our prosecutors also get a built-in expert witness in their case. It makes sure kids don't stand alone in our courtrooms. It's hard enough for them to take the stand, to face those juries, and often have their family sit behind the side of the perpetrator instead of support of them. And so this adds one more person to their team to ensure that our perpetrators are held accountable. We know from some of our studies that our perpetrators don't just have one victim. In fact, one study shows that men who sexually abuse girls can have on average of 19 victims before they're successfully prosecuted. But more astonishing, men who sexually abuse boys have almost 150 victims before they're held accountable. We know that we need this statute and legislative change in order to make sure that we can hold perpetrators accountable before they find their next victim, because that's what's happening in our cases. We also know that when you use child advocacy centers, so we can get kids to our center, it increases prosecution. And in one county, we saw that actually the increase was 196% in the prosecution rate before and after child advocacy centers. It's proven it's effective, and we know we can support our kids in this way. We're also in support of the enticement age changing from 15 to 17. From the kids that we see, 15% of them are for enticement or solicitation or human trafficking. And so this number continues to increase daily as we see that enticement reached out through social media, when we have traffickers sitting within our schools, enticing our kids and trying to get them to perform these acts that are frankly unfathomable to all of us who are sitting here today. I'm asking you guys to support this legislation as well and protect all of Missouri's kids under age 18, not just those 14 and under. Thank you for your time.
Thank you. Any questions for this witness? Thank you. Anyone else here in support? Thank you.
I know. I don't want to step on anyone's foot. Good morning. Jessica Seitz. I'm the Executive Director of Missouri Kids First, and my organization is the State Association of Child Advocacy Centers. So Ms. Robbins, who just spoke, is my member in the Northeast Missouri. I just want to go on the record in support of the whole network. When I shared that this legislation was being considered with my membership earlier this month, I had directors who have been working on this for decades, share with me that this would be one of the most influential changes to our laws they'd seen in decades. It's basically based on the principle that, 14 to 17-year-olds are kids too. And also that we must ensure that our systems, our criminal justice systems, we must do as much as possible to ensure they do not re-traumatize children. They're already traumatized from their sexual abuse. So we have this law. This would make an improvement to the laws that's been long needed. We're really pleased to see it moving forward. Thank you.
Thank you. Any questions? Thank you for your testimony. Anyone else here in support? Anyone here in opposition? Is there anyone here for informational purposes only?
Good morning, Madam Chairman and other members of the committee. My name is Amy Feit. I serve as General Counsel for Missouri Association of Prosecuting Attorneys. I am limited with regards to only being able to testify with regards to informational purposes, so I will keep it to what may be interesting facts for the committee to know. Initially, 491.075 and 492.304 are both statutory exceptions to the hearsay rule. Those were initially enacted in 1985. There's been changes along the years, but the most recent change to 492.304 occurred in 2004, where the most recent changes in 491.075 occurred with legislation from 2012. Right now, there's some inconsistency with regards to the two. 491.075 is an exception to the hearsay rule that is available for any statement that a child has made who's under the age of 14 or a vulnerable person with regards to an offense that has occurred under Chapter 565, 566, 568, or 573. Chapter 565, as you're probably aware, have to do with this. Primarily, you're going to see assault type offenses in there. 566 are sexual offenses. 568 are the endangering the welfare of the family. And 573 deal with child pornography. With regards to 492.304 right now, that only specifically deals with regards to visual as well as video and sound recordings of children under 14, and only those who are alleged to be victims of offenses under Chapter 565, 566, or 568. So one of the things that this does is this brings consistency because it will change it so that you have all the same offenses, 565, 566, 568, and 573, which is the child pornography, which certainly we see a lot of that for both of these. It also will allow this to apply to any child who's under 17 or under 18, And that means whether or not they are a victim or whether they are a witness in the offense. And it will also be applicable to vulnerable persons. So with regards to just bringing consistency between the two statutory exceptions, that will occur. Then the other thing that has already been mentioned is going to deal with the fact that enticement, you're raising the age is being raised, and you're raising the age with regards to the patronizing. It's the crime is entitled patronizing of a prostitute, but certainly we do understand that that really is sex trafficking of children. But it does raise the age, and it does raise penalties, which are very appropriate with regards to those types of offenses. And I certainly would be happy to answer any questions that I can.
So I have a quick question. I have been consistently voting against changes to the criminal code this year because it seems like we've been doing kind of piecemeal specialty new crimes has been the story du jour. This feels different than that because it's readdressing the criminal code rewrite that the bar worked so hard on several years ago and saying we are recognizing that this crime should have been classified at a higher level rather than creating new sub-crimes. Is that your interpretation of what this does?
So with regards to, and I certainly can understand the desire to not
we spent tremendous resources as a bar trying to get that right, and then it feels like we're whittling away at that effort, and we're going to be back where we had to do the rewrite before, where we had all these specialty crimes. But this seems different. This seems like we are recognizing as part of the Raise the Age effort that this was a piece that was missed, and we need to go back and fix it.
And I think that that's also very true. I think the other thing that has happened since you had the criminal code rewrite is that we have raised the age with regards to who can be held criminally responsible as an adult in the state of Missouri, and I think that you should.
It brings in an alignment.
Yes.
Okay, that makes sense to me. Thank you.
Thank you.
Your testimony was exceptionally helpful. Is there any way that you could get those talking points to my office?
Absolutely. I can make them a little neater than what they look like now, and would be happy to provide those to your office.
Thank you. I'll use them on the floor.
Thank you.
Senator, do you have any questions? Thank you. Anyone else have any further questions for this witness? Anyone else here? Nope. Thank you, Representative. That concludes the hearing on House Bill 454 and concludes our hearing on health and welfare.